Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the neuroimaging concepts and spinal cord disorders. So today we'll talk about the infectious disorders of the spinal cord. So neuroimaging concepts, part 35, spinal cord disorders, part 3, infectious disorders. The various infectious disorders of the spinal cord can be divided into 4 categories. 1. Bacteria, 2. Virus, 3. Parasites, 4. Fungi. Amongst the bacteria, tuberculosis is very common, staphylococcus and Lyme disease. So in bacterial infections of spinal cord we have tuberculosis, staphylococcus and Lyme disease. Amongst the viral infections of the spinal cord, the commonest organisms are herpes virus, flaviviruses, that is West Nile virus or Zika virus, or enteroviruses like poliovirus and retrovirus, that is HIV. So in viruses we have herpes virus, flaviviruses, that is West Nile virus, Zika virus or enterovirus, poliovirus and retrovirus, HIV. Amongst the parasites we have neurocysticercosis, that is Taenia solium, and schistosomiasis. Amongst the fungal disorders we have the cryptococcus. These fungal infections are usually seen in immunodeficient persons. So basically we have 4 categories of infectious disorders: bacteria, virus, parasites and fungi. So this is the classic tuberculosis of the spine known as POTS tuberculosis spine. So this is a sagittal T2 weighted MRI in POTS tuberculous spinous disease. So here you can see this classic angular deformity. So it comes like this, turns over and then it becomes straight. So it is like going straight and then turns over and then ascends. This is the angular deformity. So this is the angular deformity, very characteristic of tuberculosis of the spine. And generally the tuberculosis has got a tendency to affect the thoracic spine. Disc prolapse has got a tendency to affect cervical region and lumbosacral regions, but tuberculosis has got a tendency to affect the thoracic spine. So the angulated deformity of the thoracic spine is highly characteristic. So you can see the angular deformity in the thoracic spine, which is highly characteristic of tuberculosis diseases. Tuberculosis is especially common in the country where I live in, that is India. And this is the spinal epidural abscess. This is a spinal epidural abscess. So you can see here the spinal epidural abscess. So this is a spinal cord. So this is the pons medulla oblongata and then comes as a spinal cord. So these are the coverings of the spinal cord, that is the dura mater, the outer covering of the spinal cord. So here you have the infectious process, the hypointense signal. So this is the abscess. So this is the MRI of spinal epidural abscess compressing the dorsolateral cervical spinal cord. So this is the sagittal section and this is the axial T1 gadolinium enhanced images. They show this peripherally enhancing pyogenic collection which extends over several vertebral segments. So these are the images that show the peripherally enhancing pyogenic collection which extends over several segments. So very classic is spinal epidural abscess. Yeah, so these are the important concepts of infectious disease of the spinal cord. The other important clinical neurology concepts I put in a book called Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas. This book will be very useful for students preparing and appearing for clinical neurology exams. So if interested, this good book could be purchased. The other book I've written is Focused Neurology. I'm the author Dr.Sreenivas, published by CBS Publishers and Distributors. This book has got all the important theoretical points of neurology. It has been put in a nice question answer format. So this will be very useful for students appearing for Viva or oral exams. This book is available from all leading booksellers online, especially Amazon. So if interested, this book could be purchased online from Amazon. So I hope you have enjoyed listening to these wonderful concepts of infectious disease of spinal cord. If you have enjoyed this, please like and subscribe and share the channel. That is Dr. Sreenivas Medical Concept, which is India's leading neurology educational YouTube channel. And do subscribe to my FB page also, Dr. Sreenivas Concepts. Thank you. Bye.